Namaskar दोस्तों, welcome to channel Toxicology on Board. Today in this video we'll be learning about another DABT topic, that is tricyclic antidepressant overdosing, cardiac abnormalities, central nervous system toxicity and anticholinergic effects. So let's directly dive into the question. This question is taken from ABT recertification examination May 12, 2000. The question is, which of the following is not characteristic of tricyclic antidepressant overdose? Okay, we need to identify the option in which TCS, that is tricyclic antidepressant overdose, it is not a characteristic feature. We have option A, disorientation, ataxia, depression. Option B, we have dilated pupils, hyperpyrexia, and dry mouth. Hyperpyrexia is nothing but increase in body temperature. Okay, in layman terms, it is fever, decreased PR interval and decreased QRS interval and ECG. Option D, cardiac arrhythmias with ventricular tachycardia. Option E, urinary retention, decreased gastrointestinal motility. The right answer will be in the green text, that is option C, decreased PR interval and decreased QRS interval and ECG. So let's try to learn from this concept how the tricyclic antidepressant drugs and their overdose, what are the characteristic features. See, this decreased PR interval, decreased QRS interval, as well as ECG, no, heart related, whatever the changes are there, PR interval, ECG changes are there, no, they are not the characteristic of this antidepressant overdose. But if you look into disorientation, ataxia, depression, dilated pupils, hyperpyrexia, dry mouth, cardiac arrhythmia, ventricular tachycardia, urinary retention, decreased gastrointestinal motility, all these things are characteristic feature of tricyclic antidepressant. Some of which are the characteristic of this anticholinergic effects. So, along with this question, you also read what are cholinergic drugs, what are anticholinergic drugs, what are the antidote for this, some of the classic examples, and what are the characteristic features of this cholinergic drugs or anticholinergic drugs. Okay, so a tricyclic antidepressant TCA overdose is a life-threatening emergency. So, whenever a patient or any person who has accidentally consumed overdose of this tricyclic antidepressant, it is of serious life-threatening concern, primarily characterized by rapid onset cardiac abnormalities. What are those cardiac abnormalities? They are nothing but cardiac arrhythmia as well as ventricular tachycardia. Tachycardia is nothing but your increase in the heart rate. In addition to considering CVS, that is heart, as the primary target organ toxicity, it also have adverse effects of the CNS, and also it shows some anticholinergic effects. So we will see what are the CNS effects it causes and what are the anticholinergic effects this tricyclic antidepressant overdose cause. Symptoms can appear within 30 minutes. Immediately, if there is an overdose of TCA to certain patient, within 30 minutes it will start showing adverse effects. Significant toxicity usually manifests within 2 hours of ingestion. Adverse effects start showing within 30 minutes, and to the maximum adverse effects by the time of 2 hours after ingestion, it will start showing these adverse effects. Okay, as you can see, disorientation in the place, ataxia, constricted, that is dilated pupils. Okay, you can clearly see the difference between the constricted pupil and the dilated pupil, which is a typical anticholinergic action. Hyperpyrexia, that is increase in the elevated body temperature, and ventricular tachycardia. Okay, and also you can remember one mnemonic with respect to TCS, thrombocytopenia, cardiac effects, that is arrhythmia, as well as myocardial infarction, anticholinergic effects, and seizures. Okay, so seizures means in which is affecting adversely affecting your CNS system. Okay, so first we will talk about cardiac. What are the adverse effects which is causing on the cardiac CVS? That is cardiovascular toxicity. The most common cause of death is TCA overdoses, cardiac toxicity. The patient might undergo convulsion. He might have some seizures, but before that, the death is majorly caused because of the tachycardia, ventricular tachycardia, as well as cardiac arrhythmias. Okay, but not with respect to ECG changes. Tachycardia, hypotension, conduction abnormalities, arrhythmias. These are the four important features you can see in the case of serious adverse effects, heart-related adverse effects. Coming to tachycardia, sinus tachycardia is a very common initial sign to the anticholinergic effects. So TCA, they are behaving like that of anticholinergic drugs. Okay, what are the characteristic features of anticholinergic drugs? The same that of the tricyclic antidepressant. Coming to hypotension, profound low blood pressure due to alpha 1 adrenergic blockage. These TCAs will go and bind to this alpha 1 adrenergic receptors, because of which will be the decrease in the blood pressure, and impaired heart muscle function, because of which contractility of the heart will be impaired. Coming to third one is cardiac abnormalities. These TCAs, what they are doing at the membrane level, they are blocking the sodium channel in the heart, which is the key diagnostic feature. Because of this, contractility of the heart will be impaired. Widening of the QRS complex on an ECG is a strong indicator of severity. A QRS duration of 100 milliseconds, more than 100 milliseconds, is a predictive of the seizures. Okay, and more than 160 milliseconds is a predictive of serious ventricular arrhythmia. Prominent terminal R wave in the lead of VR is another classic of this ECG sign. So these are the ECG signs which can be an indicator for this type of TCA toxicity overdose. Then we have arrhythmias. Various heart rhythm disturbances can occur, including ventricular tachycardia, ventricular fibrillation, which can lead to cardiac arrest, because of which this is the primary cause for the person to die because of the TCA overdose. Okay. Let's see what are the adverse effects on the second one, that is CNS toxicity. We have CNS effect range from mild to severe, often progressing rapidly. So one of the thing in the options you have seen of seizures, altered mental status, that is confusion and delirium. This can range from drowsiness and confusion to delirium, agitation, as well as coma. Serious one will be coma. Okay. Coming to seizures, a significant complication, especially with the more severe toxicity. There high doses of overdoses of this TCA is there, then is a possibility for seizures, complicated seizure, muscle twitching and rigidity. Okay, so what are the anticholinergic syndrome that we can see with respect to TCA overdoses? The effects stem from blockade of muscarinic acetylcholine receptor. These, no, they are acting on alpha 1 adrenergic receptor. There they are causing blockade, and they're also blocking these muscarinic receptors. So then you have to remember where these muscarinic receptors are located in your body. It might be GI system, muscarinic or nicotinic receptors. They have abundance. Okay, they're ubiquitously present throughout in your body. We need to identify what are the organs. Then you can able to remember this one. So we'll try to read once again. See, this anticholinergic syndrome effects stem from blockade of this muscarinic acetylcholine receptors. Okay, so we have dry mouth and skin. The skin is often warm and dry. Then we have dilated pupils. In the first slide, you have seen the comparison between the constricted pupils as well as dilated pupils. That is another way it is called mydriasis. Okay, urinary retention. So it is affecting your urinary system. Decreased or absent bowel sounds. That is intestinal ileus. Okay, ileus. Then you have elevated body temperature, that is nothing but a hyperthermia or hyperpyrexia. Okay, these are the terminologies which are used for increasing the body temperature. These are typical anticholinergic symptoms, characteristic features. So you have here the person is undergoing seizure, and these are the your um, uh, your muscle pain or this thing. And you can see here urinary retention, dry throat, dry mouth, and constipation. Feeling hot, that is decreased sweating, that is hyperpyrexia. Then tachycardia, you have blurred vision and dry eyes. Okay, sedation, dizziness, confusion, and hallucination, these are CNS related adverse effects. Okay, so hope from this video you were able to learn about this tricyclic antidepressant overdose, how it is connected to anticholinergic characteristic features. All the options were applicable to TCA overdose except for the ECG related cardiac changes. Those were not appropriate for this particular out of the options available. Okay, though there were some ECG changes which were the characteristic features, but majority of them were ventricular tachycardia as well as cardiac dysrhythmias. Okay, along with also read with this question, please read adrenergic classes of examples of drug, non-adrenergic drugs. Their adverse effects, if you have any mnemonics, try to remember them. Cholinergic and anticholinergic drugs, muscarinic and nicotinic receptors, whereas they are those receptors abundant, present in our body. Based on that, you will be able to remember the characteristic features. Okay. So thank you. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam.